Hello, everybody. My name is Raven Webb, and today I'm going to be talking to you guys about West Nile virus. The epidemiology triad of West Nile consists of the host, which is mosquitoes. The agent can range from humans and animals. A lot of times you will see horses get the West Nile virus. And the environment, usually West Nile is in you see West Nile in areas where it's warm weather, and like the areas low in the south, like I think I looked up and it was the lower 48 states in the United States. So basically where mosquitoes are very active and there's warm weather. A little bit of history about the disease. Well, first of all, let's just talk about mosquitoes. Um, you can only get bitten by a female mosquito. Um, there are over 3,500 species of mosquitoes. And the average mosquito lifespan is less than 2 months. And West Nile virus actually came to the United States in 1999. Factors that impact the life cycle of the organism, really, basically the weather. If it's cold, you're not really going to see too many mosquitoes, but whenever the weather gets hot, that's when you're going to see mosquitoes pretty much reproduce and such. The incubation period of mosquitoes. This is the period between when you're bitten by an infected mosquito and the appearance of signs and symptoms of the illness, and this time ranges from two to 14 days. So just about kind of like 2 weeks. Routes of transmission and reservoirs. Typically, West Nile virus spreads to humans and animals via infected mosquitoes. Mosquitoes become infected when they feed on infected birds. In a few cases, West Nile virus might have spread through other routes, including organ transplantation and blood transfusion. There have also been reports of possible transmission of the virus from mother to child during pregnancy or breastfeeding or exposure to the virus in a lab. But these are very rare, and you don't see too many of these occurrences. Populations that are commonly impacted. These populations include humans and animals, mainly horses. And like again I said, these areas are the lower states of the United States, the kind of country um, areas where it's very warm and moist and things like that. Geographical distribution and incidents. Most cases of the West Nile in the United States occur June through September. Cases have been reported in all 48 lower states. Usually, mosquitoes are found in the country areas instead of city areas. And typically, mosquitoes start hunting as the sun goes down and will continue a few hours into the night, searching for any warm blooded creatures such as people, dogs, cats, birds, and wildlife. About 20% of people who develop a mild infection called West Nile fever, and common signs and symptoms of these include fever, headache, body aches, vomiting, diarrhea, fatigue, and a skin rash. And usually, if the case is very, if you just caught it, it's really hard to tell that you have it. But until the infection starts to get more serious, is when you start to see signs and symptoms. Is this a reportable disease or condition? Yes, it is. West Nile virus disease is a nationally notifiable condition. Cases are reported to the CDC by state and local health departments using standard case definitions. And it is also reported on the Mississippi State Department of Health website. Medication used in treatment. Currently, there is no vaccine or specific antiviral treatments for West Nile available at the moment. Usually, over the counter pain relievers can be used to reduce fever and relieve some symptoms. In very severe cases, patients often need to be hospitalized to receive supportive treatments such as intravenous fluids, pain medications, and nursing care. Precautions that you can take to prevent you from getting the West Nile virus. These include using insect repellent, preferably mosquito repellent, wearing protective clothing to prevent mosquito bites and things of that nature. I also saw where people tuck their pants legs into their socks to prevent, mosquitoes from traveling inside their pants and all that kind of stuff, wearing long sleeve, just being very cautious of mosquitoes. Population focused interventions and levels of prevention. We focus on populations that are at high risk, for example, the lower 48 states, and where we know mosquitoes are very prevalent and active, things like that. As far as the level of prevention, you can use primary prevention to protect ones from contracting this disease. This includes, insect repellent, clothing to protect, from insect bites and things like that. Now, tertiary prevention can also be used to treat and manage the disease once it is contracted, and that includes, over-the-counter medicines, fluids, and things like that if the disease does get more serious. Any commercials or public service announcement campaigns, I have included a video on YouTube to watch, and this link is included in my PowerPoint. Public health alert. Did you know that many horses have been affected by the West Nile virus? You can learn how to protect your horses at the West Nile website that is included in my PowerPoint. And that is all about West Nile. I hope you guys learned something a little bit about West Nile and how to protect and prevent yourself about West Nile. And thank you for watching.